everybody. Thank you for tuning in to Improve with Dr. Lindsay podcast, and welcome to episode number 2, where we're going to talk about the gap between physical therapy and participating in a regular exercise routine. So that gap goes both ways. We have people that are performing a regular exercise routine and maybe should be being seen by a physical therapist. And we have people who maybe have already been seen by a physical therapist, but are still left with some fear and apprehension wrapped around getting back into their exercise routine or even starting with an exercise routine. So let's first talk about the group of people that are already in their exercise routine and maybe should be being seen by a physical therapist. And so we'll first start by explaining what I mean by an exercise routine, because that could mean being in the gym. It also could mean working out at home, could mean just walking regularly or swimming regularly. Basically, any form of exercise that is performed routinely and regularly is considered an exercise program. And so when it comes to exercising, I find there's typically 2 types of people. We either have the people in the no pain, no gain category type mentality, or we have kind of the complete opposite, which are people who are more avoidant with their exercise routines, whether they're just avoiding certain exercises, and so they never squat or never lunge or things like that, or they're avoidant in their entire routine in terms of they only swim or they only walk or they only bike because those are the only things that they can do to stay active without pain. And the other harsh truth is that most people, regardless of what category they're in, just really don't know what they're doing when it comes to exercise. I work out in a very densely populated gym and I see all kinds of things. I see form that's all over the place, and I see all sorts of dysfunctional movement patterns that really could use some physical therapy advice and some corrective exercise. But my gym is kind of more of the earbuds in and head down type of gym, so I don't really think people would appreciate my unsolicited advice, so I keep to myself. But in this gym, and I think in a lot of gyms, the no pain, no gain mentality is super common. And there's a lot wrong with this mentality, so I won't go down that rabbit hole. But really it boils down to, I don't think most people will even realize that, the no pain, no gain type of mentality can mean that they're pushing through pain and causing themselves actual harm or injury. Which, by the way, there's a huge difference between the, discomfort that you feel in a deep stretch or the muscle burn that you feel when you're actually trying to target and work a certain muscle that just indicates a proper stretch or a proper load of a muscle, and actually experiencing pain with your workouts. And don't get me wrong, it can be somewhat difficult to kind of figure out that balance and understand how hard to push yourself and when to stop pushing yourself. But some really clear indicators that you should be being seen by a PT and that your form and mechanics are probably off is if you have pain or symptoms repeatedly when you're doing a certain exercise, or you regularly experience pain during or after you've been exercising, especially if that pain tends to linger and lingers, any longer than just a few days. And so, like I said, the no pain, no gain mentality, there's a lot that goes on with that, but the biggest issue is just people don't realize that they could be potentially causing themselves real harm or real injury. And people in the gym especially tend to start to believe that it's normal to experience pain when you're working out and it's what everybody deals with. So, it becomes the norm when it really shouldn't be the norm. And there are people out there that can help you with that exact thing. And you should be able to work out without having to push through pain. Now, a saying I prefer instead of no pain, no gain is no effort, no gain, which is what I tell a lot of my patients. You are going to feel some discomfort. You are going to feel some muscle burning. There's a big difference between those things and actual pain. But then on the other hand, we have people who are more avoidant. Like I said, kind of the total opposite. And they either are avoiding just certain exercises or they become avoidant altogether in their routine and they only stick to a few things that they know they can do without aggravating their body. And now, while as a PT, I obviously don't encourage people to push through pain in their workouts, I also don't typically encourage people to avoid certain exercises altogether, especially if those exercises are something that they should be able to do in order to perform something meaningful to them. So, we'll go into some examples here in just a bit of what I mean by that, but there's a lot of specific exercises and commonly avoided exercises that I hear all the time that are things we really should be able to do in order to participate normally in our day-to-day activities. And the inability to do those things, at least to some extent, is pretty much an indicator that you need to be seen by a PT so that you can be able to do those things and live your life normally without having to constantly compensate. Now, learning the balance between pushing through some discomfort and pushing yourself too hard can be a really difficult balance to find, especially if you suffered from pain in the past or you're recovering from an injury. And these are the reasons that you've now become avoidant of certain exercises. But those are all reasons why seeing a PT and letting them kind of guide you and lead you to how to get to those things is super important, and not just trying to figure it out on your own. And so a perfect example of an exercise that you need to be able to do is something like a squat. I hear people all the time say, "Oh yeah, I go to the gym, but I don't do squats." And when I say squat, I don't necessarily mean that you need to be able to squat with a barbell on your back and lift hundreds of pounds or anything of that nature. But you should be able to perform the motion of a squat, because that's what's necessary to sit down on a chair, to stand up from a chair, to squat down to pick something up off the floor, or to lift something heavy from the floor. We need to be able to get down into a squat. Because last time I checked, we all sit every day. We all have to stand up from a surface every day. And one of the most common things I hear is having difficulty standing up from something like a soft couch or something like that. And so not being able to do at least a body weight squat, at least with minimal depth, would be a very strong indicator that you need to be seen by a PT and learn how to perform the movement properly. Another one I hear super commonly is deadlifting. So many people avoid deadlifting, and the deadlift itself is not the problem. It's caught a bad rap because there's a lot of people trying to lift a lot of weight and doing it improperly. But the exercise itself is the same movement pattern that we need in order to pull our pants up, in order to pick something up off the floor, etc. So being able to do a proper hip hinge like that is actually super important. Another one I hear all the time is lunging, or what I call, more of a split squat. And, that's actually how I train people to get up off the floor or to get onto the floor, which is super important, especially if you have kiddos or dogs that you like to play with, or, any reason that you need to be on and off the floor regularly. That's a super important exercise that you should be able to do, is to lunge or to split squat. And the last super common example that I have for you is any type of overhead lifting. People tell me all the time that they, work out their arms, but they refuse to lift anything overhead. And the issue with that is if you're not training the proper mechanics of an overhead movement, then people think that they can go and paint their house or go play catch with their friend or do anything that requires that repetitive motion. And they don't realize that they are overstressing those delicate little structures in their shoulder, and then they're coming to see me shortly thereafter for irritating or even injuring or tearing their rotator cuff or something else of that nature. And so being able to do that motion properly and utilizing the right muscles, again, super important for a lot of different activities of our daily life. Now, again, I'm not saying that everybody needs to be able to lift heavy weights or do back squats in the gym. And I'm definitely not saying everyone should go start squatting and lunging and deadlifting and pressing right now. But what I am saying is that being able to perform these basic motor patterns are actually super essential for a lot of the things that we do in our daily life, and being able to do them properly and avoid overstressing the wrong areas of our bodies are important in terms of preventing injuries. Now, the problem with all of these things is that people tend to squat and deadlift and lunge wrong. They tend to overstress their knees or overstress their back. And so that's why they've been avoiding it altogether. And if you're going to do it wrong, then avoiding it really is the best answer. But what people don't realize is that's what physical therapists are for. And we can help you figure out why you're prone to stressing your knees with a squat, why you're prone to overusing your back with a deadlift and things like that. And we can help you retrain that movement pattern so that you can be able to do it properly and then load your quads and your glutes the way that you were originally intending to in the first place without pain. And I think that these individuals don't seek PT for the same reason that I think a lot of people don't seek PT, regardless of whether they're in an exercise program or not, is because they don't realize that PTs are available to help them with that sort of thing. There's still a very common belief that I've noticed that people still think that we are primarily responsible for post-op care or like major injuries and major accidents, but really we're there just as often to help with those chronic aches and pains or those even just minor aches and pains that you experience here and there. And we are movement experts, and so teaching you proper movement patterns is kind of our thing. And so that has a lot to do with why I started this podcast in the first place, is because I really want to help build awareness of what physical therapists do and what we're here to help with. And the other issue is many people I find are, especially sometimes in the gym setting, are kind of anti-doctor, or they don't want to be seen by another provider. And I don't think that people also realize that you can actually see your physical therapist without having to see any other provider. In all 50 states, as far as I'm aware, you can do that. We have what's called direct access, so you can directly go to a physical therapist and be seen. Now, every state has their own limitations with that, so sometimes you can't see them for a very long time without seeing a provider, but there's a lot of conditions that we can get you better very quickly, especially if it's just something that happened one time in the gym and you haven't been dealing with it for a long time. I tell people all the time, the less you've had to deal with it, the quicker it can get better. The longer that you let something go, the longer it takes us to correct that issue and get you back doing what it is you want to do. And so as physical therapists, we obviously believe in and actually prescribe exercise for a living, but sometimes we do have to pause your activity and or modify your current exercise program in order to be able to restore your function. And so I like to think of this as building a solid foundation for your future exercise routine and skills to build upon. And so we can take the analogy of building a house on a sand foundation. If you built your house on a sand foundation, that's similar to having an exercise program that's performed with terrible mechanics and limited body awareness and is essentially not serving you or your body the way that it should be. And in order to restore what's dysfunctional, we're going to have to, at minimum, take that house off the sand foundation in order to lay a new firm foundation for you. And the firm foundation is essentially the basis of what we do as PTs. And it all starts with a basic understanding of general anatomy, physiology, and biomechanics necessary to learn how to load your tissues properly and target the muscle groups that you're looking to target. And there are certain muscle groups, and especially deep stabilizers, that people are just simply unaware even exist, let alone know how to actually target them or integrate them into their exercises. These areas of the body just become completely neglected, and like I like to tell my patients all the time, they kind of turn off. And so they aren't working to stabilize you as you're performing those other exercises. And so it's a very literal analogy of having a moving or unstable foundation. But once we've set that firm foundation, then we can try to move you forward, and we can try to move that house back on and fix or refortify the structure completely. Sometimes you may even decide you simply want to build a whole new structure and build your dream home on it and do things that you never thought you could do before you went to therapy and never thought were possible. Now, I think that pretty much covers the first group of people that maybe didn't realize they should be being seen by a PT and haven't been yet. But now let's talk about the people who have been seen in PT either previously or even recently and are still unable to get back into their exercise routine, or maybe they want to get started with an exercise routine, but they don't feel confident after being done with physical therapy. Now, there's a number of reasons why this happens, but most of the time it boils down to they just finished PT too soon. And this is actually the area that I find the most common pitfalls within the PT industry, and has a big reason to do with why I started a mobile cash-based practice that focuses on flexible treatment plans that are centered around the patient, is because this is where I have found a big gap in our ability to help people. And so there's lots of reasons why someone might finish PT too soon. The first reason I hear the most often is simply cost, but not just cost in terms of money, but also cost in terms of time. And so people just kind of decide to quit before they're really done. But therapy can be a huge commitment, especially traditional therapy where they're seeing you 2 to 3 times a week for weeks or months on end. It gets to be a lot, and it can take away from other priorities like work and home and all that. So people simply just kind of get tired of it and they stop. Another common reason for stopping therapy too soon is limitations in insurance coverage. It is super typical to have a certain number of visits per year that they will cover, and or it's less typical, but you can be denied for coverage because you didn't make progress quick enough, and or you made too much progress and you're doing too well and you're able to do all the things that are required of you for work and home life. And so they don't get the opportunity to progress you to an exercise routine. But other times there are some PTs that just simply discharge you too soon. And so there's still a lot of PTs out there that are pretty reliant on just simple muscle testing and range of motion measurements. And those things can be normal and you can be able to complete your normal activities of daily life. And yet you still are unable to perform certain exercises because there's dysfunction in your movement, or what I like to call your motor control, your coordination with performing a certain movement pattern. And so sometimes that's because those PTs are not as used to seeing higher level patients or people with higher level goals. And there's a number of reasons why that can happen, but it is possible that your PT just discharged you too soon. And maybe they never even progressed you into integrating into any sort of exercise routine. A lot of the times they give a home program, but beyond that, and being able to have something where you're progressing forward and integrating the things that you've learned in therapy into your new routine. So if your PT discharged you before you knew how to carry anything over or apply it into your typical exercise routine, and you still have apprehension, that's why it's okay to seek a second opinion and talk to another PT. And that's why I tell everybody, if you've tried therapy once, it's always okay to try it again, especially if you didn't get the end result that you were looking for. In fact, most of my patients actually have been through therapy before and either failed at getting better or they didn't fully recover and get back to what they wanted to be able to do. And the last common reason that I see people quit PT too soon is simply because they get to feeling better and they get relief of their pain and they just think they're good to go. And so they decide to discontinue. And the issue with that is that reducing symptoms is really just step number one in the physical therapy process. We have to first get things under control. Then we have to restore whatever is lacking, and we have to correct movement patterns, and then hopefully transition towards a progressive exercise program that eventually leads to your own independent management and integration of these things into your normal routine. And that all hopefully works to help prevent the issue from reoccurring in the future. And so people end up feeling better, and then they just kind of get stuck doing the same exercises they were initially prescribed in the beginning, and they don't keep progressing forward, which also means that while they may feel better, they're not necessarily doing anything to correct what initially caused the pain and therefore preventing it from happening again. So we've identified the gaps between a regular exercise routine and physical therapy, but what are we doing about those gaps? And this is something where more non-traditional therapists like myself are looking to kind of bridge that gap and fill in those holes where we can be helping more people. And I personally am working on this podcast for that very reason, to help with spreading awareness, to help people be more body aware and self-aware, and also more aware of the services that are available to help them either get them healthy or to keep them healthy and moving well. And really hoping to get more people into therapy before they have those major injuries. I also offer free phone consultations for the same reason, to try to be a resource for people, to spread awareness of what not only I can do to help, but what therapy in general can do to help, and hopefully reach those people that may not have otherwise reached out and thought that they were a candidate for therapy or that they needed therapy. I also offer annual appointments for healthy or asymptomatic individuals. And so this is an appointment that's performed every year that I look at people head to toe and assess their strength, their range of motion, and also look at those functional movement patterns to hopefully work to identify any impairments that may lead eventually to other issues. And we get to things before they're a problem. And so I recommend this annual appointment for really everyone, whether you are active or pretty sedentary, but especially for those individuals who are really active, because they're placing repetitive load and stress on their body with non-optimal mechanics. And so that annual PT appointment can really help to kind of point out those areas that need to be addressed in order to be able to exercise safely and properly. And then the last thing is I offer flexible treatment plans. that are created really for the individual needs of the patient. And that's really to decrease the commitment on time. It's also to decrease the burden of cost and to help individuals reach those long-term goals at their own pace. And so my goal with my treatment plans is essentially to just mold to whatever really works for you and your life instead of making you make this giant commitment in order to get to those longer term goals. And lastly, my services are also mobile for that reason, to try to improve efficiency and help with that carryover between what you learn in the clinic and what you can do for yourself in your home or gym environment. And that leads to just more lasting results. And so I want to leave you with a few questions today. 1, are you experiencing pain in your workouts? 2, do you live with a no pain, no gain type of mentality? 3, are you avoiding certain exercises like squats, deadlifts, lunges, overhead movements because they're painful? 4, have you been seen by a PT and never fully recovered? And 5, have you been to a PT but still have apprehension about being able to work out? Is this because you don't have the confidence that you're exercising properly? Or because you're afraid of re-injury? Or because you just don't know where to start safely? If you said yes to any of these, then I recommend getting checked out by a local PT. And if you're local to Tampa, Florida, then make sure you get signed up for a free consult with me to talk about whatever you're dealing with. And as far as the free consults goes, I'm always available to chat with people and help them learn about therapy. So even if you're not local and you just want to kind of learn about what's out there, I'm always happy to help you. I just can't physically come and see you. But again, feel free to schedule that free consult and learn a little bit more and talk about what you're actually dealing with personally. But as a society, let's work together to move away from the no pain, no gain mentality, start living life with self-awareness instead of self-neglect, and start doing something about our situation instead of complaining about it and or muscling through it. And so as always with Improve with Dr. Lindsay, we hope to provoke thought, expand understanding and awareness, inspire and motivate, and most of all, improve your life. Thank you guys so much for tuning in. I wish you the best week ahead, and we'll see you back next week for episode number 3, which is all things posture. Looking forward to it. Talk to you then.